And thanks everyone for coming. We called this roundtable together because the House Democrats have introduced HR 3, the Lower Drug Costs Now Act, and this is one of the main things that we know affects Americans. Almost one in four Americans either forgoes prescription drugs or takes half of them or doesn't take the prescribed amount, trying to save money on prescription drug prices. And so this was part of our original commitment that we were going to take on prescription drug pricing. I think Barry was the one who mentioned that this is a bipartisan issue. I mean, it doesn't matter Democrat, Republican, Independent. I think we all recognize the need for us to get something done to lower prescription drug prices in this country. Just briefly, some of the things we talked about, there's pretty much four major parts of this act. One is allowing Medicare to negotiate prescription drug prices. There's a question between the 25 and 250, what exactly that means, what are those drugs, I think is a big issue, as well as are generics going to be included in that as well. The other one is holding our prices on an international pricing index. Basically, we don't want U.S. pharmaceutical companies gouging Americans while charging those same drugs, making them available in other countries for far less. And then basically, how are we going to hold pharmaceutical companies accountable? And then finally, limiting out-of-pocket costs. There's a piece of the bill that will limit Medicare beneficiaries to $2,000 per year. I think one of the questions that was raised here, and we can go around with that as well, is who's getting the benefit of those price caps? And basically it's obviously the consumers, but where does the recovery from penalties go? And does it go back to the Treasury, or does it go to insurance companies? Does it go directly to consumers? So those were some of the major things that were raised here today. Also, we talked about the one main provision that I think a lot of us have concern about is the 340B provision, which would basically affect nonprofit hospitals like UMC. And so that was another concern. So the reason this forum is so important for me is because when I go back to Washington and am talking to my colleagues and we're working on this bill, working it through committee, I can take back the concerns from our local community, from actors in our community who represent our seniors, health insurance, our hospitals, our consumers, and retirees. And so this is such an important forum for me to have so that I can be informed from the bottom up and represent my constituents back in Washington. So we had some of a discussion earlier, but we're gonna wrap this up. I'm just gonna ask one question if everyone can weigh in. Southern Nevada, we have such a unique healthcare dynamics because of our demographics, and especially when it comes to our aging population. What message do your organizations have for Washington as Congress takes on this new Democratic prescription drug plan?
Well, I think for AARP, prescription drugs do not work if you cannot afford them. No one should have to choose between buying food and medicine. The cost of prescription drug often rises at least 2 times the rate of inflation. So something has to be done. We have to stop the RX greed that's going on. So all across the country, AARP has been working with our members and the general public at doing something. We're so glad that Congress is finally acting on it. AARP has supported HR 3 because it does a lot of the things that we're looking for that's going to make prescription drugs affordable to the people who really need them.
I think I'm representing Unite Your Health, which represents the self-funded planned community in Nevada, and we worked on this nationally to increase transparency in pricing in the state, and then federally we're very happy to see some real teeth go into some legislation that is going to penalize the poor actors in the pharmaceutical industry. Our plea with that for HR3 is that it's a beginning and not an end, because we think there's a lot of work to do, but it's certainly a strong start. We'd like to see consumers be protected, but we'd like to see our health plans protected too.
Yes, I'm the president of one of the Nevada Alliance for Retired American chapters here in Southern Nevada. And we fully support anything that will lower the good drug cost and the prescription cost for our members. And we're really happy that Susie Lee is carrying this fight. We're really grateful.
Andres Ramirez with Protect Our Care. We know that we've heard from countless Nevadans that are still risking their health and their lives by skipping prescription drugs because they can't afford them and the prices are increasing. It's only complicating their health, it's complicating our healthcare system, making it more unstable, and so we support this process and this proposal by Democratic leadership to ensure that we at least have a starting point along this conversation of how we make healthcare more affordable to Nevadans.
On behalf of the Nevada Hospital Association, we're always interested in ways that the consumer can be protected. I think HR3 and helping to lower those drug costs will ultimately be huge for this population, and ultimately can also help the hospitals as well keep their costs down, which is also a big concern for us, and passing that on to the general consumer.
Absolutely.
And I'm Maria Teresa with Battle Born Progress. We work on a variety of issues, but this one is probably the one that can be a little bit more heartbreaking, because we've heard stories from many of our volunteers that give their time and energy to do good things in their community, but when you get to know them, you find out that they're battling some kind of illness, or they have a family member that's battling some kind of illness, and they depend on prescription drugs to survive.
Right.
And we actually have one woman, Vivian, in Reno, who actually, she goes to Amadee's, her congressman, Mark Amadee, his office every Friday to ask him to do something about this. And so we are happy that you're doing something about this, and we want all of Nevada's congressional delegation to do something about this. And the message we would give to you is that thank you, and this is a good first start, but we do need to do a lot more, because for decades, the pharma industry and their lobbyists have kind of owned Congress and owned the way that this industry is done, and that needs to stop. We need to give the power back to the people that are fighting to survive every day, and that they shouldn't go bankrupt. They shouldn't ration their medicines. They shouldn't have to debate whether to pay their rent or, actually get some food on the table because they need to save the rest for medication. So we need to take pharma on, and this is a great first step.
Yeah, I must say, with respect to taking pharma on, this is HR3, but HR1 was For the People Act, which was really getting at the core of what you talked about, which is getting dark money out of Washington and basically making sure we're more accountable to the people we serve. And and I agree with all of you that this is a excellent first start, and we will continue to do work along this to make sure that we continue to make pharmaceutical drugs more affordable. The one thing I want to point out is when we talk about healthcare costs in general, and what, to your point, I mean, this is a prevention measure. I mean, if people are rationing their medications or they're not taking their medications, it has impact on their health, where they end up accessing our emergency rooms and accessing our far more expensive healthcare, where this can be a way, we make pharmaceuticals more affordable, where people can take them in a preventive manner. It keeps them out of our hospitals, it keeps our healthcare costs down along those lines as well. And I do have to give a shout out to Nevada and all the work that we did in this state. We are leading the way in terms of transparency in pharmaceutical pricing. And so I'm sure that our work will affect what we do in Washington as we take this important issue on. So does anyone have anything else to add?
I want to add something you mentioned that nationally about 25% of people don't take prescriptions because they can't afford them. AARP looked into that recently, and here in our state of Nevada, it's about 27% of people either stopped or do not take their prescriptions because they can't afford them.
I would add that representing the health funds, we see hospital costs as our number one cost trend, and we see prescription drugs as our number two cost trend. And prescription drugs used to be our number 3 or 4 cost trend. And we have not seen a way to actually break through the issue of pharmaceutical industry. No matter what's been introduced, at the end of the day, they're still left pretty unharmed. And they've done that by obfuscating the issue with complicated rebates, but they've also done it by pointing the finger to everyone else. And I think that this bill starts to put the onus back on the originator of the price that you're talking about. Healthcare is too expensive because price is too expensive, and that's a manufacturer decision.
I have nothing further to add.
We support you.
Thank you for your work.
All right, well,
Thank
thank
you.
you. Thanks everyone for coming. Thank you.
Alright, so, members of the media, when